is Fawn. I'm a nurse. I'm gonna be doing your postpartum check. I just wanna make sure everything's going okay. How are you doing? So I'm gonna check her emotional status. I'm gonna make sure she's doing okay with her and her spouse and baby. And if I can just verify, we're gonna identify her. So can I verify your last name and date of birth? Okay. And then ask a few questions. So have you been able to urinate yet? And so you should be having 30 mLs an hour. And it should be, if you have a Foley, then it should be clear yellow urine. And have you had a bowel movement yet? And it's normal to not have one in the first 24 hours. We're going to give stool softeners in the meantime. So we're going to start with vital signs, which blood pressure should be the same as first trimester. It should be 120 to 80. The pulse should be 60 to 100. Temperature should be 98.6 to 100.3. Respiration should be 12 to 20. And then we're going to ask about pain. And it says pain, and we should also make sure to check within pain the location, the characteristics, and the intensity. So we're going to go ahead and check your breast. Have you noticed any colostrum coming in yet? So we're going to notice if there is colostrum. We're going to check the nipples to see if they're everted, inverted, flat, any trauma, and check if there's colostrum in. Then we'll check the fullness. And that looks fine. As we move down, we're going to check the fundus. We're going to check that it's midline. It should be midline at the umbilicus. And we're also going to check the firmness. So if it's firm, if it's soggy, boggy, soft. If it is deviated to the right, it means that it's a full bladder. If it's deviated to the left, then it could be clots. If it's soft, it can also mean signs of hemorrhaging, so you're going to want to massage that. As you're checking the fundus, you're going to want to push down and check the lochia. And with lochia, you're going to have 72 hours of rubra, which is red, bright red bleeding. And then it can last up to 6 weeks, and it will slowly change over time to pink, clear. While we're down here, we'll also check the perineal area. You want to check for redness, edema, ecchymosis. If there's any lacerations, you're going to want to check that and check the approximation of that. You're also going to want to know if there's any discharge. If she has a C-section, you check the incision site. And if there's any drainage or any signs or symptoms of infection. If there is drainage, you're going to want to mark it with a pen so we can keep track of that. As we're moving down, we're also assessing the skin. So we're note for any tensing, any sweating. We'll check cap refill on the fingers. And then we'll go ahead and move down. Also at this time, we'll check for hemorrhages. Hemorrhoids. So we'll check the size of the hemorrhoids on the back side. And we'll move down and check her feet. So we're going to be noting the color. If there's any redness, have you had any pain in the calves? And if she had hypertension, we're going to check for clonus and her DTRs. But for now, we're going to check Homan. So just slightly touch if there's any pain, redness, warmth to it. Check for any swelling. Or check pedal pulses bilaterally. And then we'll go over things to let us know for. So with the bleeding, you're going to want to let us know if you fill up more than one pad in an hour, or if you have clots bigger than the size of a golf ball, you're going to want to let us know that. Also, if you develop any chest pain, shortness of breath, or difficulty breathing, definitely give us a call. If you have with hypertension, there's a potential for seizures, so again, call us if that happens. You're going to want to let us know about any temperatures over 100.4, or if you have any thoughts about hurting yourself or baby. If you have a severe headache and it's not getting better with any Tylenol or any medications, or if you have any vision changes, let us know as well. And then I just want to talk to you about your breast really fast. So if you plan to breastfeed, which is great, or even if you have to bottle feed, but if you plan to breastfeed, just be aware of mastitis, which your breast can be red, it can get streaky, it can get warm to the touch. It can also give you a fever, nausea, chills, like signs of infection. So you're gonna wanna give us a call, get in with your doctor so you can get antibiotics. You're still gonna wanna breastfeed baby, even though you have that. Or if you have any blocked ducts, you can use a warm compress and still, again, keep on feeding baby on that side. That's gonna help unblock it. You can use colostrum once baby's done eating, kind of squeeze it out your mouth and just kind of rub it on your nipple to help. When you take showers, don't use any soap because that can dry your nipples out as well. Just use water to rinse it off. Use a good supportive bra. If you don't plan to breastfeed, a kind of more tighter bra, sports bra will help. And taking warm showers will help to alleviate. If you have any other questions or concerns, just give us a call and we're here on the call. Thank you.